Welcome to this presentation on learning resources available to pharmacists undertaking the newly qualified pharmacist pathway. During this presentation, we will talk you through the purpose of the resources, how to access them, and briefly discuss the types of resources available and how to best use them to support your learning and development. The purpose of the resources provided are to aid in your development as a newly qualified pharmacist. They are designed to complement existing learning programmes that you may already be undertaking, such as certificate or diploma programmes, and using workplace experiences to shape your learning. The resources will support this. The resources are grouped according to the RPS Post-Registration Foundation Pharmacist Curriculum domains. We suggest you look through the available links, bookmark items you feel will be useful to you, and use them when you identify a learning or development need. The most effective way of identifying learning needs is to carry out a learning needs analysis and then discuss this with your educational supervisor. There are many learning need analysis templates available, and you are welcome to use whichever you find most beneficial. The link here is a micro learning needs analysis tool, which is accessible within the Domain 4 set of resources. You will then be able to select which learning packages best meet your needs and create an action plan with your ES. Links for the resources are accessible on the Health Education England Pharmacy website. To access some of the resources, for example, Open Athens, e-learning for healthcare, and Script, you will need an NHS email address. If you do not have an NHS email address, such as if you're working in a community pharmacy and your employer has not provided you with one, there are directions on the website to help you obtain an NHS email. Within the resource library, there are 7 tabs available to explore: Wellbeing resources, clinical and patient-facing resources. This is available as a tab on its own within the library, as well as the content being available within domain number 2. Then we have domains numbers 1 to 5, communication and collaborative working, professional practice, leadership and management, education, and research. Selecting domain 1 opens up a range of links to resources focusing on communication and collaborative skills, such as assertiveness, empathy, consultation, giving feedback, delegating, networking, and influencing. All these skills are essential for meeting the RPS capabilities of communicating effectively and placing the patient at the centre of interactions, delivering person-centred care, and collaborating with the wider pharmacy and multidisciplinary team. Domain 2 provides 2 sets of resources, one set, as previously mentioned, focusing on clinical and patient-facing skills, the other focusing on professional skills such as critical evaluation, decision-making, shared decision-making, and human factors. The resources available will help meet the capabilities of applying clinical knowledge and skills in practice, and drawing upon and critically appraising appropriate information to inform decision-making, managing uncertainty and risk appropriately, and practicing professionally. The resources available include learning on decision-making, medicines optimisation, and medicines information. Domain 3 relates to the following capabilities: promotes pharmacy services and develops the profession, recognises opportunities for change, innovation and quality improvement, and demonstrates self-awareness, resilience and adaptability. Examples of resources include people, risk and time management, delegating, raising concerns, leadership and effective change. Domain 4 relates to the following capabilities: develops personally through proactively identifying learning opportunities and reflecting on feedback, supports the education and development of colleagues, and resources for this include learning from constructive feedback, teaching, helping others learn, the learning needs analysis, microlearning as we discussed earlier, and mentoring and reflection. Domain 5 relates to participating in research. Resources include guides about report writing, critical evaluation and quality improvement projects. The Resources Library section of the HEE Pharmacy Newly Qualified Pharmacist Pathway website contains several useful resources across all 5 domains of the RPS post-registration pharmacist curriculum. For further information, please contact the pharmacy team on their email address provided, pharmacyteam@hee.nhs.uk.